PPHC has done amazing things for my family. By providing amazing nursing care and therapy care, my kids continue to grow stronger every day. This is Kaden. She's 5 years old now, and she is a former client of PPHC. She received speech therapy and actually occupational therapy at one point. She did graduate from PPHC therapies. They helped her learn to speak and communicate better.
I'm Mackenzie Garland. I'm a registered nurse. I've been with Angel for about 7 months now. I work with Angel. I'm here from 8 to 5, Monday to Friday. And 3 days a week we go to school. So we go to school for half the day in the morning, and then we come home and have therapy with our occupational therapist, our physical therapist, and our speech therapist. And Angel also has the really cool opportunity to go to augmentative therapy once a week for her Tobii eye gaze device. She's really smart, the smartest little girl ever, even though she can't tell you with her words. She says it with her eyes a lot, and yeah, it's really beautiful to get to connect with a child just simply by being together.
My name is Amy. I'm a physical therapist at PPHC. I have been working with Angel for quite a few years, and it has been an incredible journey. When I first started to see Angel, she was on oxygen 24/7. We would take it off for about a minute and she would turn blue, and she is no longer on oxygen during the day. She's just incredible, and it's great to be able to collaborate with the other therapists, the speech therapist and the occupational therapist. It's more of a gift to me than anything. Right, Angel?
Hi, I'm Linda. I'm a speech therapist, and I'm working with this little boy today in his home. One of the things that I love the best about home health is that you get to see kids in their natural environment. You get to use some of the things they have in their own home, as well as bring in some new toys that they can use. It's fun to give parents and caregivers an idea of how to use things in their home, or just typical toys like this little book, you know, how they can use those in therapy and work on meeting some of their goals. Yeah, the best thing about home health is just being able to see kids and teach parents how to help them the same way that I help them, especially because I can only come once or twice a week. So the carryover is a very important part of therapy.
So this is Riley. She was a victim of shaken baby syndrome when she was 2 months old. She was a totally typical 2-month-old baby, and was shaken at 3 months old. And this is why you're hearing some of her talking and needing to chew on her chewy for sensory exploration. She's unable to walk or talk or eat. She's completely blind, and so depends on all of us to provide care and make sure that she is safe and gets to have a good quality of life. The nurses at PPHC come with an enormous skill set, from G-tube care and trach care and ventilator care. They're able to provide not only medical care but overall child care, and I know they're safe. Typical people couldn't take my kids to school or babysit them or give me a break to go out to lunch or run errands. With PPHC nurses, I know that my children are safe, and that if there's an emergency, they'll know how to handle it. From respiratory distress, or a G-tube becoming dislodged, or the medications, keeping on top of medications and making sure that they're getting the right doses at the right times, and their feedings, and they're tolerating their feedings. And if they're not tolerating their feedings, they know how to handle it.
I think a lot of people don't see all that's involved with being a pediatric home health care nurse. To be able to work with a ventilator and do suctioning and trach changes and her G-tube feedings, it's just an opportunity to have like high acuity in the home setting in order for her to not have to be for her to be able to be independent in her life. I feel like I grow on a daily basis in my job as a nurse and my education as a nurse, and PPHC has offered the opportunities to go to respiratory classes and feeding tube classes and all of those things in order to be able to further my education.
The progress they make is amazing. It may seem small to most people, but every little bit of progress is so meaningful to us. Being able to tolerate touching things that they used to not be able to touch, or learning to communicate without using words, enabling them to interact with their environment and other children, adults, and just be part of our entire family. Joining us with birthday parties and getting to tuck them into their own beds at night. All of these things PPHC help do to keep the children at home and not in a hospital.
I want people to know that that the kids with special needs are no different than anyone else. I mean, it can be scary sometimes if you get worried, but if you have that place, if you have time alone, it's helpful. I mean, it's just like if you were to have a normal brother or sister.